Hello everyone, today we will be learning about ABG interpretation. There are total 4 steps of ABG interpretation. The ABG means the arterial blood gas analysis. Let's go with the first step. In the first step, we should know the normal value of pH, that is 7.35 to 7.45, and if the pH value decreases, it indicates that it is acidosis. If the pH value increases, it denotes that it is alkalosis. If the value is above the 7.45 means it is alkalosis. If the value is below the 7.35, then it means it is acidosis. And in the second step, there is bicarbonate level. We should have to see the bicarbonate level, whether it is below the normal range or whether it is above the normal range, and it denotes, it is related with the metabolic cause. Bicarbonate means, we should have to think that bicarbonate means it is metabolic. So if the bicarbonate value decreases, it is metabolic, and same is like that of pH, it is acidosis. And if the bicarbonate level increases, it is, of course, it is metabolic, because here is bicarbonate, and same as that of the pH, it increases and it is alkalosis. So here the easy way to remember is that here in both pH and bicarbonate there is HH. So if it is increases, then it will be alkalosis. If it is decreased, it will be acidosis. This is easy way to remember. And in the third step, we should have to also know the partial value of the carbon dioxide, and it denotes the respiratory causes. And the normal value of partial carbon dioxide is 35 to 45 mm of Ag. And if the value of the carbon dioxide decreases, then it will become just opposite, not acidosis, it will become alkalosis. PaCO2 means, we should, if this will come, then this will be, of course, respiratory, but not acidosis, it will become alkalosis, just opposite in nature. And if the PaCO2 value increases, then this will be the respiratory, not increases means not alkalosis, it is acidosis, just opposite nature. So after learning the third step, now let's go with the first step. Then here sometimes it comes with the compensation. If the pH value is not normal, then it is called partial compensation, and if the pH value is normal, then fully compensation has occurred. We'll discuss it later with the examples. So now let's see with some of the examples. So let's go with the example. In the example number 1, pH value is 7.48 and bicarbonate level is 30, PCO2 is 37, and the pH value I have given here the examples in the left side. 7.35 to 7.45 means 7.48 is above the normal range, means of course it is alkalosis. And bicarbonate level, it is 30, means it is above the normal range, means alkalosis. And PCO2 level 37 is, it is in normal range. So just don't look about this normal range, we are only looking this two. Here alkalosis, so just write alkalosis here. And in alkalosis, pH value just below the pH value, here is bicarbonate level. Bicarbonate means it denotes the metabolic cause, so we should have to write it is metabolic alcohol. So here, going with the next example, pH value is 7.48. Here I have written the normal ranges same like above, and 7.45 means it is above the normal range, means it is alkalosis. And here PCO2 level is 30. 35 to 45 means it is decreased. In CO2, see there is O, means opposite, it is decreased, means we should have to write here alkalosis. And bicarbonate level is 26, means it is in normal range, so we should not look this, we should only see this two, means alkalosis, you are writing here alkalosis. And here the PCO2 means here it is respiratory, so then we should have to write here respiratory alkalosis. See, isn't it so easy? And we have next two examples to make it clear. The third example, here pH is 7.52, means it is it is above the normal range, it is alkalosis. PaCO2 is 48 means it is in the above the normal range, so here CO2C means opposite, not not alkalosis, we should have to write here acidosis, and bicarbonate level is 28. 28 means above the normal range, means it is alkalosis in nature. So we might get confused in this type of situation, like see there is both alkalosis and one is acidosis. So what to write means just go with the two. Write here alkalosis, and alkalosis means what? Here it is denoting the bicarbonate, that is metabolic cause. So write metabolic alkalosis. And whether it is partial compensated or fully compensated, I have already mentioned earlier that to be the partial compensated, pH is not normal in partial compensated. In fully compensated, the pH is normal. So here is the pH is normal? No, here it is 7.52, means the pH is not normal, it is above the normal range. So here we should have to write partial compensated metabolic alkalosis. Let's go with the fourth example. Here pH is 7.37, it is normal range. PCO2 is 27, it is below the normal range, so it is alkalosis. Here bicarbonate, it is 18, it is below the normal range, it is acidosis. Means now how to interpret this result, because pH is in normal range and here one is alkalosis and one is acidosis. So in this case what we should have to do is that 7.35 and 7.45 is normal pH value. Let's keep the 7.40 is the mid value of these two. Less than 7.40 it is acidic, more than 7.40 it is alkalosis. So we should have to see whether it is more in acidic side or more in the alkalosis side. Means 7.37 means it is more in the acidic side, so it is acidosis. And here acidosis means here what it is denoting, it is denoting metabolic. We should have to write here metabolic acidosis. And whether it is fully compensated or partial compensated, I have already mentioned earlier, the pH value is normal, so it is fully compensated. This is all about the ABG analysis. So that's all for today. If there is any queries, then let me know in the comment section. Thank you.